What I think really drew me to naturopathic medicine, and to talk a little bit about what naturopathic medicine is that it's a holistic approach to healthcare. And I really like this because it looks at the whole body, it looks at the mind and the body and all of the different systems within the body, with the understanding that understanding these connections between these different body systems and the mind allows us to come up with more effective treatment protocols, better ways in which we can help people. And the other piece too is that naturopathic medicine really aims to support the body's own ability to heal itself. And I think that's particularly relevant with colds and flus, because part of what we want to see is we want to have our own immune system be able to deal with the colds and flus that we come into contact with, so that we don't get as sick as often, and when we do get sick, it's not as severe. Okay, so the first thing is to talk about what are colds and flus. What exactly are they? Where do they come from? What causes a cold or a flu? Shout it out.
What causes it?
Yeah, what causes a cold or a flu? Germs. What are germs? Viruses. And what else?
Bacteria.
Bacteria. Viruses and bacteria. Perfect. How do you tell the difference between a cold and a flu? Flus tend to be much more severe and more sudden in their onset. And the symptoms tend to be more systemic. So we're more likely to have a fever, body aches, and what I mean by systemic is symptoms that we feel throughout our entire body, as opposed to localized just in our head, right? Or in our upper respiratory tract. But that's not always the case. You can actually have a fever with a cold as well. So it can be difficult. It can be difficult to totally differentiate. And at a certain point, maybe it doesn't matter so much, per se. One of the other important pieces is to understand that the causative agent can be a virus and it can be a bacteria. And this can be important to try to figure out, because our treatments naturopathically, as well as from a Western medical perspective, can be very different depending on whether it's a virus or bacteria. The other thing that I think is interesting to think about too is the idea that our immune system reacts, and part of why we feel sick when we are infected with a bacteria or a virus isn't so much due to the presence of the specific bacteria or virus. It's because of how our immune system reacts to their presence. So it's the process of our immune system coming into contact with that virus, reacting to it, causing inflammation, which is a way of the body, it's the body's way of signaling to the rest of the immune system that, hey, there's something here that we need to fight, there's something that we need to get rid of. But sometimes that inflammatory response can get too big, right? And it's this inflammatory response that causes our symptoms. So inflammation causes blood vessels to dilate so that more white blood cells can come to the area, while blood vessel dilation brings more fluid, which causes a runny nose, perhaps. It causes more mucus to come into the area. All of these things start to lead to all the symptoms that we feel. If there's a necessary response, if there's something that's present that needs a big response, then it's inflammation and all of these signaling pathways that lead to a fever. Right? Fever is the body's way of letting the body know that, hey, there's something here that we need to combat, and that's saying, hey, let's get going, white blood cells, let's come to the area, there's something here to fight, right? So it's important to keep that in mind, because that changes the approach, right? So oftentimes we hear about wanting to boost our immunity, and it's just this general idea, let's boost our immune system. But if we're not smart about the ways in which we boost our immune system, sometimes we can actually make the symptoms of our cold or a flu actually worse, because there's particular parts of our immune system and our immune response that are actually causing the symptoms. And we want to make sure that we're boosting the parts of our immune system that are specifically fighting the bacteria and the virus. And we want to make sure we modulate and keep in control the parts of the immune system that are causing inflammation, and that are causing the reactivity that can lead to a more severe set of symptoms. The next part of what I want to talk about is talking a bit about prevention. So one of the ways I think that we can prevent the incidence of colds and flus is by actually staying home when we're sick, not exposing our coworkers to these infectious agents. This is nice too, because this fits in with the naturopathic philosophy, I believe, because part of what I think is important is to take care of yourself when you're sick. If you get sick, to allow yourself to get sick, give yourself that time to not go to work, to try to let go of some of the stress that comes with that. The next part I want to talk about is boosting our immune system and some general ways in which we can do that. And the first one is sleep. So getting 8 hours of sleep a night is essential. It's been studied again that less than 8 hours of sleep is depressing to the immune system. Some people have trouble sleeping because of anxiety. Maybe anxiety is causing it, making it difficult to fall asleep at night, in which case there can be some psychotherapy ways in which to deal with that, and some tools and techniques that one can learn to help deal with their anxiety at night. There's also lots that can be done from a herbal perspective. There's lots of great herbs that help relax the mind and relax the body and allow for an easier time falling asleep. Okay, the next piece I wanted to talk about was stress. We just talked a little bit about stress and caffeine, right? So stress, we know, has a depressing impact on our immune system. When we get really stressed and we feel a lot of stress, our immune system, we take energy from other parts of our body and funnel them into this stress response. Now, you probably all know what a good diet more or less looks like. So lots of fruits and vegetables, not eating a lot of junk food, not eating a lot of candy, refined carbs, and eating a balanced diet, these kinds of ideas. I won't go into too much detail about that, but what I thought would be interesting is to talk about some specific foods that have a specific effect on the immune system. Drinking plenty of water. I think this is really important, keeping your fluids up, making sure that you're able to eliminate waste through your kidneys regularly. It helps keep your circulation system functioning properly. It keeps your lymphatic system moving. This is one of the ways that your body gets rid of the waste that accumulates when you're sick. So like I mentioned before, when inflammation happens, all of those white blood cells start to break down, and we need to clear away this waste. It needs to leave the area, and all of those chemical messengers that cause inflammation need to get cleared away as well. And so a lot of fluid is helpful for all of this. It definitely needs to be mentioned that decreasing the amount of sugar and refined carbohydrate that you intake is really important. So we know that increased amounts of sugar causes a depressing effect on the immune system. So trying to be really careful about how much sugar you take in is really important. It's probably one of the most important things to think about in terms of diet, in terms of food. And the flip side of sugar intake and refined carbohydrate intake is protein and fiber. So oftentimes when we're eating a lot of carbs or we're eating a lot of sugar, it looks like our protein intake is down. So if we change that up a little bit and we start to focus a little bit on taking in an adequate source of protein, it can start to compensate for the fact that we're eating a lot of carbs. Vitamin C is boosting to the immune system. I think everyone is probably aware of that. That's been around for a long time. And I think it's really true. I've seen vitamin C be very helpful. And so focusing on some of the foods that have high amounts of vitamin C can be really helpful during the cold and flu season. Selenium is a micronutrient that can be really helpful for boosting the immune system. It actually has a stimulatory effect on phagocytes. Now, a phagocyte is a kind of white blood cell, and it's one of the white blood cells that actually eats other bacteria. It engulfs them and then breaks them down. And it also does the same thing to virally infected cells. So this is an example of an immune cell that we're very interested in stimulating. It's not one that's going to cause excessive amounts of inflammation. It's actually one that's there to clear away the virally infected cell, or the bacteria that's present, right? Zinc. Zinc is another one that boosts the immune system. Zinc supplementation in the elderly, and they found that it actually reduced the incidence of infection in the elderly. So it's nice to see when some clinical trials support what we know already in terms of nutrition. Garlic. Garlic is a great food to add in. Garlic is a nice one because it boosts natural killer cells, lymphocytes, macrophages, and phagocytes. There's evidence supporting its stimulatory effect in all of those. And again, those are all specific types of cells that have the cell-mediated direct effect on pathogens. But it also has an immune modulating effect. It actually reduces some of the inflammatory pathways that can result from our immune system being stimulated. So garlic has this nice double effect, stimulating where we want it, and it's modulating the parts of our system that we want to keep nice and calm when we get sick. Green tea is a really powerful antioxidant, and that's what people know it for. But it actually also functions as well as an anti-inflammatory, and it reduces histamine production. So this is important in reducing the part of our immune system that can get out of control and cause severe symptoms when we do get sick. And green tea is beneficial in many, many ways. It's helpful for reducing the risk of cancer. It's helpful as a general antioxidant, supporting the cardiovascular system. The next piece is fish oil. Fish oil is a great thing to supplement with. And vitamin D doesn't really function like a vitamin in the normal sense of the word. It's actually more of a hormone. It's a messenger in the body, and it binds to cells throughout the entire body. And one of the kinds of cells it binds to is, surprise, surprise, the immune system. All of our cells in the immune system have vitamin D receptors. And the impact of vitamin D when it binds to those receptors is it has a modulatory effect, because what can start to happen is cells can start to forget, in the sense of what their job is in the grand scheme of our immune system. And vitamin D, it's been shown to really help refine and focus the jobs that these different immune cells have.